definitely, even I am telling, right, many people have told me, even on my face, that you are not a candidate of diploma. Like, why did you take diploma? You are a MD candidate. And I'm like, okay, what is this diploma candidate and MD candidate? They value it according to the skills you have or something.
Hello, this is Dr. Dheeraj Masapu. I'm a consultant neuroanesthesiologist, and we have Dr. Hema with us today. And she's doing NBEMS Diploma in Anesthesia in West Bengal, one of the hospitals. So we're going to ask her a straight question today. So Hema, you're 1 year into NBEMS Diploma. So how do you feel? Because some people are actually leaving NBEMS Diploma and going, some people are continuing. So what is your state of mind and how are you preparing?
Yes, glad I'm back again to this channel. Thank you, sir, for having me. To be frank, it's almost been like 1 year, 2 months has been finished into this NBEMS diploma. Even at first, I was also confused whether to stay in the branch or even in the branch, I was confused. So after 1 or 2 months into the, training program, I just decided that, okay, fine, like I can do this and this is my branch. Like there's a lot of depth in the branch, so I'm happy to learn the knowledge. So what has happened is, like, in the past 1 year and even now, in between, I still feel that did I do some mistake of like taking in a diploma or like rather than taking MD course, because like anesthesia is like very vast and like difficult to like grab the knowledge of everything, and even we get all those like not the scoldings, but the part is that nobody can teach you the whole anesthesia because theory is like very difficult. So at the times we feel very depressed and we don't know whom else to say also, because even our professors or like teachers or seniors, most of them are like MD passed outs, and most of them, because it's a government medical college, so everybody are like mostly MD passed outs. And even if they have done diplomas which are like 20 years, 30 years ago, they have finished their secondary MD. So it is like very difficult. Like they are very helpful to us in helping us about theory and also the practicals, but still there was this thing like it is us at the end of the day who should be confident enough in both theory and practical. So even there were days that where I felt that I should be leaving the course and maybe I should try again, or like even after 1 year of the course also I felt that. But for everything there is a balance. Like you have to check the both pros and cons. So coming to the pros, I felt like even if I have done an MD in some institute, and maybe if I could not get this type of like teachers or professors or seniors who could help me in this way. See, anesthesia is not about just intubating a patient or giving a spinal. So it is more lot of that than that. So I just felt wherever you are, it is in your hands that you should learn. Okay, if the seniors are not helping, it's okay, because everybody has their own life and everybody are busy, and nobody can just make you sit and like make you study every topic, because that is like very huge. It's not like some other branch which has only one particular system or like one particular like age group. Anesthesia is such a branch that we don't have a specific age group of patients. We have to be dealing with a 1-day-old neonate to like 100 or like till the patient is alive. So it is very difficult, and nobody can teach you sitting in just 3 years or 2 years course. Even in 3 years, it is not possible. So how can we expect in 2 years? So I felt that it should be in me, that whatever I'm learning, like first take 1 day. Like if you're going today to the OT, you just think about yourself, okay, what did you learn today? If you even do one case, you should be happy enough. Even if you learn one line of the textbook, which is very important and that might be helpful to save a patient or for your exams or anything, you should be happy with that. Like, like you have to learn to be happy in small things. It's not that just within 1 month of you getting into the anesthesia that you should be able to do all the cases. It is not possible. Not even after finishing of 3 years of MD or DNB or any 2 years of diploma course, you will not be a pro. Even our teachers, there might be a difficult case which they can't do. So you just don't think that you should be a pro. But I just felt that I have to make little steps so that I can reach. And the main problem where I get is that studying part, theory part. Because in this very busy schedules, like we don't get time to read, sir. I'm like very frank in that.
That is a problem, no? Academics won't be there, I think. Academics are not there.
Yeah, that is the main problem. Because most of the places, academics is like very nil. Because I can't say that if academics is good in like my college, I can't say that even if there is a government medical college which has MD also, like they will not be having good academics. So you can't say that this institute is good or this institute is bad. But the thing is, you are here, right? Now you can't change anything. Either you have to waste a year. If you have that stamina, that is a different scope. Because if this is your life, so you can't just keep on wasting the years or like time, and you don't know what happens in future also. So just think about the present situation. You have got some place. So at least if you are learning a skill, you keep in mind that okay, I'm learning the skill. I'll go to room or like I'll just go back to the hostel and then try to give more time in studying so that you can have a balance. What is your aim? Your aim is just to clear this diploma and then next to go further in your life. So I understand it is very difficult, but still, like we have to keep ourselves motivated because nobody is going to. If you want to cry, cry. It's okay, no problem. Even I cry. It's like I'm literally telling, even I cry. Even just yesterday, I had a fat practical exam, and day before yesterday, I was like very devastated. I don't know, and that was in a very reputed center and I was like I don't know, I really don't want to like make myself very low in front of them. I don't know why, it's just an exam and they don't even consider it in the finals, but still it is about me, like my confidence of like how I'm like letting other person to see me. So I was like very very devastated. I was like, I was crying, like literally I was crying that night. So it was okay to cry, it's no problem. But once when I went into the exam and I have seen that the professors were little good and then like they were asking me, so I was like, just don't panic, just say however like you literally know whatever you know, you just say it. So it literally went well and they were also okay satisfied and I got a clear pass in the exam. So it's not even a borderline or a fail. So thank you, sir. But you know, I just felt only one thing. But after that, I realized that I am not up to mark because they have asked many questions which I could not answer. Even the you might feel that it's a basic, but there is a lot. Even in a small ET tube, whichever whatever we are doing, like I think till now I have intubated like more than 300 patients or something. So it doesn't matter how many patients you're intubating. If you don't even know like what is the use of the YouTube and what are the, I mean like parts of it or like everything, you know, it's not just you intubating. You can just see that even a normal any lay person whom you train to do a thing, like anybody can be doing that. So the practical knowledge is different. But if you have a practical plus theory knowledge, that makes you a better person and to save the lives. Okay. So I just felt that anesthesia is such a branch. I have already told to people. So try to learn what you're doing. Don't try to learn everything. At least if you're giving spinal, try to learn everything about spinal, including the needle, what type of needle you are using, and what is the size of the needle, and why is the needle like that, and like are the like previous needles also of the same material, and what is it made up of? Why is it made up of like this? And what are the, so it is very important, and what are the structures you are piercing, what will be the difficulties like of the, you know, you have to know the whole anatomy also, and you have to know the physiology of like if you're doing for a cesarean section patient, if you're giving spinal for a cesarean section patient, and what is the difference in an old age patient, and what is the differences or difficulties in a pediatric patient. So you have to know each and everything. It's not that yeah, I can give spinal like now it's almost like 3 to 4 months, or I have passed my first year. So now I'm provide spinals. Now I know everything about spinals. It's not that. Because once you start reading a book and keep discussing with your co-PGTs, that will be very helpful. If you feel that your seniors or like professors are not teaching you anything, it's okay. Just come back to the room. And even if your co-PGT is not interested, yesterday there was this ma'am, like she was very good, and she herself told that, you know, if there is a pillow, you just keep the pillow in front of you, and whatever you read, you start explaining. Okay. And I know most of the people are antisocial or like they are not that much into like social media or stuff. So, you know, like taking a picture or like creating a video, you don't have to post it anywhere. At least you take your mobile, start whatever you read, you start telling to yourself. Because whenever you go to Vivas, it is very difficult. If you can't speak up, it will be a difficult problem. And even in the OTs or like when you're talking to the patients or like seniors, I think the first thing is you should know how to talk. You know, everything depends on your communication skills. If you're going somewhere, even if you want to please a person that, sir, like, can you please give me the chance to do this? If you just ask him, "Okay, sir, I want to do this," so it's that intensity of the thing that you have to show them that you're eager to learn or you're eager to know it. You do one thing, just today study some difficult topic or a topic which you want to learn. You learn about it, and next day go and ask your teacher or senior that, "Sir, I have studied from so and so book, and I still feel like it is like very difficult for me. Like, can you please explain me this? Or if you have time, can you please tell me? I think that you have done this well." Or like, any senior, what they want is a little appreciation that the work what they're doing. It's not that they want it. It is like we have to show them the respect and gratitude that you have done so much, so you have to help me to do. So no, it literally helps. Most people are not practicing this. They are like, "Hey, oh, okay, you have done many years," and okay, sometimes they even judge people. Like if they can't do a case, they feel like, "Hey, he can't even do this case. What will he teach me? He can't. He don't even know the exact theory. How will he teach me?" Just imagine you're still studying and you can't remember what you're reading in the morning by the night time. And how do you expect a 50-year-old or 60-year-old or a 40-year-old person who has studied his theory like long back to explain you like each and every point? Definitely it is not possible.
Not possible.
But actually, if the people are into the like NES, yeah, so it will be a different thing. And if the and yeah, especially sir, like I just want to ask you this. Like now we are doing neuro anesthesia, right? So it will be completely into neuro part, right? General part, I think you might have also forgot, like most of
I've forgotten actually.
so
Only neuro part
this thing, everybody, yeah. So this is very difficult thing. Even the general anesthesia, it consists of all the things. So in the student phase, even like everybody has passed through that phase. So show the respect. Even if you go to rotational postings, if you go into a specific department like pediatrics or like neuro anesthesia or CTVS, you might think that one or the other part they are more better because they are doing a specialization into that. So you can't compare the professors who are in general anesthesia or who are in like neuro or CTVS. So learn whatever you can get from them. At the end, you have to learn everything. So it might mix up. For example, it's been I think more than 1 to 1.5 months that I have not given a single spinal, like subarachnoid block, because mostly I'm dealing with CTVS. They were like mostly PTDs, and it was not.
How come CTVS
It was
posted
like
there?
very yes, sir. Like I was divided. Like we had good amount of cases. For example, in ENT, ortho, and general surgery over there in my college. So here, what we were like done is like I have done pediatric surgery here. Like I'm still doing it like for 1 month and 15 days in CS and 15 days in neuro anesthesia, and then 15 days in plastic surgery and 15 days in urology. I mean neurosurgery. So it was divided that way, so
everything
that after
around
going back to like
in
my
Kolkata, everything around your in the West Bengal only, no? In different places.
in one medical college. Usually, what happens is like there are like a few renowned colleges here. Like one is NRS Medical College, one is RGKar, and one is SSKM. So whatever the regional or district hospitals or whatever we have, so every college has one connection. Whoever has the DNB or diploma, even some hospitals who have the primary DNB course, they even send their like students to one of these hospitals because there are a lot good here. So we have been connected to NRS Medical College. So I am in this college right now, and this is a top hub for pediatric surgeries. Like we get to do like all the, pediatric hands-on cases, even neonatal cases. So it is very good. So I thought that would be a great thing. Like my ma'am is also like very good into giving us a part in CTVS because we don't know what we will be becoming like after finishing our anesthesia. We might go into neuro or we might go into cardiac anesthesia or like. So this is a step for us that we will be knowing what will be right for us. Because the one negative thing what I feel is in our internship, if we had a proper posting of anesthesia, like even it's a 15 days or 20 days or 1 month, if we have a proper posting like what anesthesia looks like, I think most of the students who have finished their MBBS, they will have a clear mindset whether if I have to take anesthesia or not. That is very much lacking. So I did not want, or like maybe my ma'am had a very good approach of it. So she's like, she never discriminated us, saying that you're a diploma, you still have to do your DNB or your MD, then you will be entering your DM. She was never like that. She's like, you still have the opportunity now, so you go. You don't have to do anything in CTBS because they'll not let you. If they let you, you're lucky enough. But go and see like whatever happens there, and you will know the pros and cons, whether you should be taking a DM cardiac anesthesia or not. At least you'll have that idea in your mind for 15 days. So I felt that is a very good idea also to get to my teacher. So I was very good, and I was very lucky enough that we had a cardiac transplant in other college, but then like my ma'am has helped me to take, and so that was a very good experience for me to say, because I don't think heart transplants are like very like not done, right? Like very few of them are done all over India.
Yeah. Actually, diploma in NBEMS diploma, most of the people message me saying that there is no teacher for us, there is no cases, interesting cases happening. But in your place, I think it's very happening. You are getting exposed to multiple cases and different varieties of cases. That is what I'm wondering.
So yes, sir, I can surely say this, that my college had one plus point of having good cases, and one more plus point is that I should say that my HOD ma'am is the gem, sir. Like with her only, like she's helping us, and also like you have to show your interest. If you don't show your interest, nobody is going to, because there are a lot of students like who are doing, and nobody got to see the cardiac transplant or like any other thing. See, unless you ask for it, I am like, like I'm just back of her all the time. Not only like my HOD ma'am or like any professor or like any SL, like I'm like always back of them. Ki, sir, please, can you do that? Like actually, I got an opportunity of, I even known about that by my SR. Like he has texted me because that was his, PG college. Now he is an SR. So that was his PG college, and he had in the group some discussion going on, and he has told me they were planning to do a heart transplant. So if you have any interest, if you want to go, you ask the permission and all the details clear, and then maybe you might get a chance to go. So I was like, I didn't even deny, or like I didn't even delay 1 minute also. I immediately called up like whom to ask and how to go and everything. And I was like so happy that I got to see that. So it is your enthusiasm and like how long or how far you can go to get there. And you should not be depressed. You can ask them. If they don't give you chance, don't feel bad. It's okay. Even my mom she was like very good. Like you just ask them. If they say no, don't force them, because that is not a small issue, like small thing. Cardiac transplant is a very big. So they don't even allow their PGTs. So if they're allowing you, that will be a very good thing. So they have allowed me, and I have seen that, and like it's very like good thing, right? So I just tell you only one thing: you have that interest in you, but if the other person denies it also, don't keep a hard heart on them, or like don't feel like nobody helps me. Like don't get into a negative way. Maybe you can think that okay, not this time, maybe next time, or maybe some other thing I can get it. But keep trying, keep asking. So even one day, even your seniors, they also have heart. They also came from the same juniorship, right? So they will feel like, acha, okay, she's asking like for so many times, or he's asking, so I should help them. They can't help you everything with help, but they will help you. I say respect your seniors, whatever they say. They scold you or they like, I don't know. I don't know what to say. But there are toxic people. You can avoid them completely. There's no issues. There will be toxic people. You have to avoid them. That's it. You don't have to show them on their face, but just
avoid and go there.
like just ignore it, because for your goodness, it is for your goodness. So yeah, I feel. It is happening, so it is good. I'm happy to be in this place.
So
West Bengal is like, I don't know.
Now, what about district hospital NBEMS diploma? Like many of the seats are in district hospitals. Will they have this kind of exposure? I don't think so.
I have spoken to few people. Few of them has told that, especially like when I went to the FAT practical, I have met few people, and they said some places there are only like ortho cases where they give lot of blocks, like and some places there are only gynae cases happening. So I know that will be very devastating to think also, but it's okay. Whatever you're learning,
whatever is there, we have to learn from that.
I have seen people telling that they don't even get ENT cases properly. that they will be getting that. One of my friends yesterday, like he was telling, I just did only one tonsillectomy case, and we got it as a short case. Discussion. So it will be difficult, and I have done like a lot of tonsillectomy cases. So for me, it will be different because when you do a case and when you keep doing a case, at least while doing the case, you will know the thing.
So now I'll ask you a tough question. So what books are you reading for diploma? Recently, I did video with Karthik. He told that Morgan is the book, the go-to book during MD anesthesia. For diploma, what books are you reading?
Okay, so to be frank, even my seniors have suggested me that Morgan is the go-to book. Okay, even I'm doing diploma, but still they have suggested me. But okay, I'm telling my view. I felt even in the Morgan there are like lot of topics which are not covered, and even I did not think like I can surely say that if I'm reading, I'm like literally keeping layers aside and spreadings aside, and also like Morgan, and it is not easy. And I didn't feel like Morgan is the only book to read. You'll not have a clear concept. What might help you is like start doing the classes. Like even if you're doing MD anesthesia or anywhere, like if you're doing anesthesia residency, I ask you to watch. There are a lot of YouTube videos which are free, like by ISA, Indian, Anesthesia Society. So it is very good. There are a lot of videos which are very case-based discussions are also going on. So it will be helpful even for MD students and also diploma students. So because I have got queries from MD students also who are doing MD anesthesia, like they are like very blank, like where to start and what to read and everything. So I feel Morgan is the first book, because I can't say you start reading Miller's, just open and start reading Miller's, because it is a very difficult language. You even Sweltings also you will feel like it is a very difficult language. But Morgan's is such a book that it's a very simply written. Like you can understand, even if you don't understand that much English, or like the subject is very difficult, or like difficult to understand the theory, you will feel like Morgan is very easy to read. But if you are someone who has started reading and you have read 2 to 3 chapters, or like 4 to 5 chapters, and now you're in your second year, or like end of your first year, and still you are not sure like what you're doing, or like about the concept of one thing, then you can refer to other books. But I think Morgan is also a very good book. But if you want in-depth knowledge, or like you're not sure about one specific topic, you have to keep reading other books. For example,
NBE also conducts classes, no, regularly. NBE will conduct classes.
very regularly, sir. Like they have a very regular classes. Like every Wednesday we have one class, and that is like pre-planned, and they send us invitation through our Gmails. So you can even plan accordingly. Like I have a book which I keep noting that, so on what day, on what are the classes I'll be having, will it be useful for me or not. And I can't say that there is no class that is not useful for me. Every class was like very useful, and I try to record it. Okay. I know most of the people are saying it is very difficult to record. You can screen record if you're using iPhone or like iPad. You can screen record, and even in Androids, I think you will have that opportunity to record. And especially what I saw is in MacBook, you have a plus point of recording the voice also. So that was very helpful for me. But in iPad and iPhones, like you will not be getting the audio of what they're like teaching you, but at least you'll get those slides, because all these NBE classes are not recorded; they're only live, so you can't get them like whenever you want to watch it. So mostly I ask my teachers or like professors or like whomever are there, like I try to gain, and even if they don't give any access also, you just open your phone and then keep the class going on, screen record it, and after going to room you just try to at least look at the slides. You'll at least know the what is the theory behind it, right? Even you can't listen to the voice, and there are some like what should I tell you, there are some groups of anesthesia in YouTube, so you will have at least one or two. See, this is all depends on you, how much interest you have to learn, because nobody is going to push you. So Even I was also in your same place. I was also kept thinking that what should I do? Should I study? Like there is no one to help me, and from where should I study? Even after we having lot of theory classes going on, we are presenting the cases and like we have a case discussion, and still we can't even finish 20 to 30% topics. So it is very difficult. Anesthesia is like very huge. So you have to keep working on yourself because from the basics nobody can teach you. So that is a very difficult thing, sir. That is the main drawback also, because most of us have thought that 5 marks, just 5 marks in NEET-PG. So most of the people left the subject also. And for 5 marks, who is going to study all the circuits and all the ET tubes and also the case discussions and all the drugs and everything? So I don't think everybody has got into that. But anesthesia is not about drugs, medicines. The main important part is that you have to know your anatomy well, physiology well, pharma. I have repeated this already in my previous video, and I'm repeating again. Even I still feel that why the hell I am doing all the 19 subjects again. I still feel that, but there is no other way, because this is your brand. This will feed you later on when you go, right? This will feed you outside after you go. You get money only by like doing work. Now you can't stop and do some other stuff, and ultimate goal is to earn money, right? And without knowledge, you will not have confidence. And without confidence, you can't give a case outside. Nobody will hire you. Nobody will hire you. Even if you're MD or even if you're diploma, nobody will hire you if you don't have that confidence. So I just want to say, okay, try reading Morgan. It's a good book, but there are other books also. And there is this book called Handbook of Anesthesia, and there is a small book called Drugs in Anesthesia book. This one also I felt this is good. This is a very pocket-friendly book and very simply written, and like very simple. It is very simply written, and if you don't know about any drug, you can just open the book and still I am telling you, if you want to clear your exams and if you want to give some answer in your exams for NBEMS Diploma or DNB students, I am telling you particularly, whatever you read in any book, just go and once have a look what is written in Miller's or any other standard book, which is like a standard book. You know what is meant by standard book? There are a lot of books like Jyotinad, which has a very clear cut answers for everything, and it's a very huge book. I can't show it to you because I just have it. I mean, behind my eyes.
I tell you one thing. Dr. Kaushik Jyotinad has come in my interview. There is a video in my channel, cardiac anesthesia versus transparent anesthesia. He's a cardiac anesthesiologist, and he's my MBBS batchmate also.
Oh wow, that is so good. So because Kaushik Jyotirnath book is like very famous among all the students who are going to exam.
He's my close friend.
It's very well written and it's very in depth. Like nobody can even finish the whole book. As people say that you can't finish whole Miller's, even Jyotirnath is like that. Yeah. But I'll tell you that is not a standard book. So whatever you are reading, once go to Miller's and try to inculcate, because there are some like human errors, like like typing mistakes also, like there are a lot of stuff. But once if you have that confidence in exam that there are a lot of tricky examiners, right? They'll ask you, okay, where did you read it? Like where did you find it? Because I have been to one CME, and there is one other book called Tata. Tata Memorial Hospital also releases one book that is a Tata book, and that also like very exam going, but it's very friendly. So what the person has told is that, where did you learn this from? And he's like, sir, in Tata book it was written like that only. And the examiner was like, is the Tata standard book? What is Tata book? Like what is that book? Like is a standard book for anesthesia? And if you say the same thing for your exam, he will like literally fail you. Not about NP or DNP or anything. Just imagine. So, and that's the basic common sense you have to use sometimes while talking to people also. Even if you read it from Tata,
tell Miller's.
Even if you think like telling, he'll be like, no, I read it in Miller's only.
Yeah, that is better.
You can bluff him. When you bluff him, when you have read the same topic in Miller's, if it is written same. If you don't have that confidence, you will be afraid to tell that also. What if the examiner has read the Miller's, the topic? Then he will have a very bad impression on you. So see, if you don't get an answer in exam also, it is fine. But never ever lie and make it as a, I mean, very bad scenario. I mean, I have learned that. If I don't know, else I don't know. But I will never say that, no, sir, I read it and that was there only. Because I have seen many teachers asking me, okay, where did you read? Where was it written? Then when I'm very confident, I say, no, ma'am, it is written in Sweltins or it is written in Chestnut, that it is clearly written. Okay, it is only 10 newtons, like, like the pressure which we apply, the record pressure while doing the RSI. I have learned it from Chestnut obstetrics anesthesia. So I have told my ma'am that it is, ma'am, 10 newtons only. And then she's like, where is it written? Like, did you even read it or did someone say? I said, I am the person who read it, ma'am. Like, I can show it to you. Then she was like, okay, fine. Because the confidence in what you say makes the other person to believe you, at least if they have not known the answer or like if they don't know also. If you just bluff, they'll be like, you are just losing yourself. That's it. I can say only this thing. And this is a very, some other book called like Oxford Handbook of Anesthesia. If you don't have anything else, like if you don't want to buy any other book also, I feel like this is a very good book. It is like very beautifully written, like simple, it is simple language which you can understand about all the cases, whatever you deal like in everyday life is like clearly written. Even I mean, non-operating room anesthesia is also a little bit written, and ICU part is also written. So it is a good book. Even the ethics is a very important topic. You have to read the ethics, and the consent part is very important. We might think, this is so normal only. We just say you're going to come into a surgery, like you have to give the consent, patients are giving. No, there is a thing that how you have to deal with it. You will get it in your experience, but when you read something and when you imply that in your practice, that is a very good thing. Like you will have more confidence. So by this time, you would be knowing, right, sir, like how you were in your like MD days or like days, and after DM and after now you are as a consultant. So you have seen the difference, right, sir?
Yes,
so you can
mine
also
is a different
just
story.
tell us like.
No, see, basically, mine is a different story. If I start telling, then it will not relate to the audience, I think, because we are a super specialty league, no? So our training will be different. The books that we follow will be different. We only follow the guidelines, actually. So when we tell something, we have to tell from which study we are talking about. It will be different.
So you have told me about the guidelines. Yes, there are a lot of guidelines, and depending on the guidelines, or even like as sir said, even we follow the same guidelines. Like, there are a lot of guidelines in general anesthesia also, which is like like how should I tell you? Like, for difficult airway.
DAS guidelines are there for difficult airway. DAS guidelines for tracheostomy.
Like for difficult airway intubation. So you have to know that, because if you don't know the guidelines, nobody is going to help you. Even if you say you're a very good anesthetist, if you don't follow the guidelines, then you're not a good anesthetist. So everybody has to follow the guidelines. And there are a lot of guidelines changing also. They change it every 5 years or 3 years. So depending on, so whenever you read, you try to read the latest guidelines so that you will have more knowledge and grip onto that. And ACLS and BLS, it's the, like, it has to be bread and butter to all the anesthetists. Even if you're just a diploma student or like DNB student or MD student, there is no difference. You have to learn.
It is mandatory, no? You have to do that before exam, I think, no? Something like that is there.
Yeah, definitely. Even just before 15 days, NBE has conducted a program. It has told to all the district hospitals and whatever, wherever the program of NBEMS Diploma is going on, and the DNB is going on, it has told that a CPR awareness program has to be done. And in my institute, it was very beautifully held. More than 200 plus participants, like including all the HOD of general medicine, and all the PGD students have attended. All the watchmen, even the people who are general workers in the hospital, they have also attended, because CPR is such a basic life support which you can be giving to a patient. Like when if you can save a life, it's a very good thing, right?
Yeah, correct.
So it was a very good initiative by NBMS. I felt like it was a very good initiative by NBMS. So after, and I can assure you one thing: if you don't keep doing a thing every day, you'll definitely forget it. Not only you, not only me, like any human being will definitely forget it. If you are not doing ABG, like like for normal cases, we don't do ABG. So how will you expect that whenever you like just wake up in your in your dreams also you have to know how to do ABG. So being a doctor is only difficult. And in that, being an anesthesia is a very volatile subject. I'm telling you, it's a very volatile subject. So you have to remember all the drugs, values, and also the dosages. So it will be difficult. But the thing is, you try to learn the basic concept of that. If you have finished your MBBS and come into residency, I feel like you literally have a good IQ than other people. So definitely you can do it if you keep trying it. So whenever you read a topic or study anything or do a case, try to know the what is the core knowledge about it. It's not that just superficially don't do it. Even if you're doing one case, if you do like I don't know, I have done a lot of lab poly, laparoscopic cholecystectomies. Now I am pro, now I don't want to do that case. It doesn't happen that way. I promise you, even if you have done 100 to 200 laparoscopic cholecystectomy also, there is some or the other thing which you can't be answering. Because nobody has that power to tell you everything. Even if you study everything and go, the examiner might ask you a difficult question which you can't be answering. So don't worry, just learn the basics. Even I was taught that yesterday that they will not ask you a very deep or very difficult question that you should not be answering. 80 to 85% they will be asking you the basic questions which you have to be knowing in your residency, and the other 10 to 15% part will be anyhow it is very difficult, and they will just ask you so that you will know that this is not what it is, like you have known everything and this is not what it is. So I feel if you want to know the books and everything, I can tell you Morgan's, just buy Morgan's, and Swelting's Physio and Pharma. There's a book called Swelting's Physio and Pharma, and Swelting's Coexisting Diseases. That is a very good book. And especially for obstetric anesthesia, if you're interested or if there are a lot of cases going on and we have a lot of time to only indulge in obstetric anesthesia, there is a book called Chestnut. You can read that. And even for neuro and CTVS, cardiac, and there are for each and every department, there are different books. Even in NB website, if you have downloaded your proforma, there are a list of the books which NB suggests you. So most of the books, what now I got to read or like I'm liking, most of them were like given in the NB website. I have just seen before few days, and most of the books are from that only. So you don't have to panic.
I'll give you option now, or a video versus a topic reading. Which one will you prefer?
Okay, if you give me that answer, if I have to answer you that, I will first see the video. I'll get a view of like what is important and what is not and what I have to learn. Then I will start opening the textbook. I will read the theory of that. Then I will underline the stuff. So that, because when somebody explains you in a 1 hour video, you should not expect that they will be telling you from the very basic point. It will not be possible, right, sir? I think it will not be possible. So you have to know the basics. And few of us, and even me, even I don't know a lot of basics which are like taught in like MBBS first year or second year and everything. But we tend to forget it, right? We can't keep reading every day. So what happens is when you revise from a video, and then when you take into the theory part, it will be very helpful, and you make your own notes. Then you will understand where you are lacking. See, some parts you might feel like, when I already know. You might feel that I already know this. Why am I reading again? Or why am I listening to this video again? If I'm perfect in ABG, you don't never think that why should I even read again ABG? Or why should I even listen to this class? No, there will always be one or the other point which will be easy than what you have learned, or there might be some other point which has been added. So I feel, don't think it's a time waste. Try to learn from the videos also, and I think there are a lot of apps also coming, sir, coming up. There is one. Yeah. So I know like 2 to 3 apps like which are like raw online anesthesia and also e-commerce anesthesia. So I think even Marrow will be coming up with the, I mean, anesthesia
many will come
classes.
in future, correct?
Yeah, even Preplada might release. So it is that it depends on you, but you have to know that like what works for you. And this is a very big disclaimer. What works for me will not work for you, or might not work for you. And what will work for your seniors, that might not work for you also. So try to keep some time, give some time for yourself. It's okay, even if you have finished your first year, even if you have finished your half of your second year, you're doing your diploma course, it's okay. You still have 6 months more time. So I feel you give you a good amount of time and start from today or tomorrow and try to know how much you have learned and how much you are willing to learn and how much you have to learn. And making a notes is a very good way. I think it has helped me a lot. And yeah, I'm still not 100% up to it, but still I'm trying to learn. Even I have read 1 to 2 chapters from Karthik sir's notes also, which he has written. So there's no negative thing, Don't ever think that you're already reading Miller's and you're also reading that, and now why are you reading someone else's book? Because you have limited time. So don't feel that you should not be reading from here or there, but whatever you read, if you want a confidence or anything, just go to a standard textbook and try to, just get the confidence from there that, okay, this is a theoretical knowledge which is correct. So I don't have any problem in writing it in exam. Ultimate thing is to pass. But more than that, the important thing is you having your basics right. So
how many papers are there
say that,
in the exam? Like diploma exam also will have 4 papers.
No, sir. If it's a primary DNB and MD, they have 4 papers. But in NBEMS Diploma, we have 3 papers, sir.
Okay.
I don't think there is a much of difference, because when NB has released that pattern, I have seen that in the 3rd paper, it has included all the recent advances also into the 3rd paper. But what happens in MD and primary DNB exams is that in the 4th paper, all the recent advances and some different topics or the miscellaneous part comes into the 4th paper. But what diploma, board has done is that it has included in 3rd paper. So there is no difference that, yeah, you should be studying only limited, but you have to be studying all the recent advances also. And it's the same book, there is no difference. The only thing is you're getting a diploma and they're getting degree, and the duration is 2 years and the duration is 3 years.
And the thesis is not there.
Thesis, the thing is thesis is not there. But you still have the paper presentation and poster presentation, which all the other residents are having. The only part
paper and the poster is mandatory then. Okay.
Yeah, it's mandatory, sir. So you have to be doing one paper presentation. So, and I think if you have interest in what you are doing, and if you really like the branch, you will go forward. Not only this branch, any branch, I feel that, sir. If you think that if you really only want to pass an exam and just basically you have to earn some money, anesthesia is not that branch, because lot of emergency cases and you deal with the patients on the spot. So you cannot bluff with this branch. It is a very difficult branch.
Correct.
You
can't be casual with the branch. You should have the capacity.
Exactly, you can't be casual with the branch. And now you are under your senior guidance, okay? Even if you do any mistake, they are there to cover up for you. But once you finish off this 2-year course and go outside, and if you want to give a case, you should not have that fear in your spine, okay? When you are holding someone's spine to give anesthesia, if you have fear in your spine, you will not be going forward. So I wish we only got 2 years of time and limited time. You gain whatever confidence you can gain in only this thing. And another thing, sir, people are going into for 3 months of rotationship. It was it is a mandatory by NBE to send us to a facility which has all the branches and compared to whatever we are dealing with right now.
Only government or private also can you go?
No. So like NB has just told that whatever, like for example, my college has a link up with other college because even the other institute must agree, right? If you are sending some person to their institute, they should also agree to take them and then teach them or whatever it is. So if they have that mutual understanding, I think that would not be any problem. So you can ask, and I have heard from few people also saying that my teachers or professors or my institute is not allowing or sending us to other colleges. So in this issue, and I can't say what you can be doing exactly, but try to please your seniors or like ask your institute members to send you. And if you still can't do that, and if you feel that I'm like helpless and everything, just write a letter to NBE. If it works out, it will work out. Because I have met a girl who has done from some other state, and there was like nothing. Literally, even the cesarean sections or the obs kind of cases were also like only hardly like 30 to 40 in a month. So they have written a letter to NBE that we are not able to do our course here and it is very difficult and we can't be able to learn anything. So what has NBE done is that they have cancelled the license of that institute and hospital, and NBE has done a very good thing that they have given the student opportunity to do in a other institute. I have met her during my FAT theory exam, and when she has told me this, and I was like literally shocked that you're not going to lose your ear and you're not even going to lose the thing. When you speak up for yourself, when you bring what is the reality into the world, then only you will have, because this is your life. You don't expect, if you even cry or if you even have your this thing now, you just will have some time to like cry in front of others. They will listen only for once or twice, and again you have to face the same issue. So if you are really having an issue, you try to solve it. If you can't solve it, try to take help from others. And still, if you can't do anything, then for everything there is a solution. I feel like for everything there is a solution.
But she has a lot of guts actually to write a mail against the place where she is working. It's a maybe I wouldn't. I would have somehow finished up 2 years and have gone from.
No, even when I have heard that, I have asked her, she's like, I have a flight to catch up, I have to rush soon. And she's like, why? Why do you have a flight to catch up? And she's like, no, I have done this thing. Then I asked her, then why did you get a FAT exam center in like West Bengal? Like, why in a different state? Then she has told me the story. We didn't even have like 10 to 15 minutes time from the place where we like sat exam and to just get out of to the place, and still I have gained some knowledge, right? So it is not always about like you wasting your time, and try to speak up. Communication literally helps, and I feel like even if you can't help other people, it will definitely help you once you start communicating. Because in our ship, like we are a doctors and anesthetists, you will understand this after you get out of your residency. How much important it is to conversate. You will gain patience only by your talks, not by your like if you keep like doing the MD, DM, AIMS or like JIPMER or anything if you write also, and if you don't have the skills to talk. And there are a lot of people who have not even finished their MD and still like giving good.
Correct.
Right.
Yeah, soft skills are
it is
important.
These all are like not taught in our institutes, right, sir?
Yeah.
Because this is not what we are taught. So it is, you have to. It's not about your future also. At least think about your Viva exam. If I talked this much, and still yesterday in the Viva, I was like, like this, like I was not even able to. So, you will only do that but the ones which I'm very confident about the cases or like whatever I'm doing, I'm like very happy. Like, how I'm talking right now, I'm like very happy saying. But when I don't know the answer of something, we can't bluff there. It's like automatically you feel like, I don't know the answer. If I say something wrong, they might think that I don't even know the basics. So best that you keep calm or sorry, ma'am, I don't know, I'll study or
Yeah.
something. You'll get the fear. Even now, I feel like I have to start recording my own videos so that it will be helpful for my future, because that was just a fact practical. Like it's a formative assessment test. But when
No,
I go in
I
the
told you
final,
last time also to open a channel and start recording. It will be
sir,
helping
opening a
many ways.
yeah, definitely. So, but right now, I mean, it might be difficult. Maybe in future, with your help, after I finish my diploma,
Sure,
I'll
sure.
try to open. And then that would be more. I mean, happy for students also to see that one of our, I mean, like students who has passed her diploma or like finished her course, and she
Correct.
telling us might be helpful.
They will
So it's
relate to
not
you
about a
actually.
diploma. Exactly, sir. I wish that at least like this length of my talk, at least if one word helps you also, I'll feel so happy. And I'll feel happy that sir has helped us a lot to save at least one person to be, I mean, clarity about their branch, what they're doing and everything.
No,
There's a
no,
lot to talk, but
yes, this diploma is
yeah,
actually, painful position actually. I'm understanding because a lot of comments come to me. That is why I'm doing this video. Because being an MD is a straightforward matter, but being in a diploma is like you don't know actually whether you're doing right thing or wrong thing. That is why I want you to speak out and so that they understand what's.
definitely. Even I am telling that many people have told me, even on my face, that you are not a candidate of diploma. Like, why did you take diploma? You are a MD candidate. And I'm like, okay, what is this diploma candidate and MD candidate? They value it according to the skills you have or something like that. But I
Mhm.
have seen a lot of people who had done their diploma and they are doing very well in their life, rather than people who had done their DM also.
Mhm.
So there is
Yeah,
you uh, have. So first thing what I'm saying is, you have that in your mind and your heart. Think that you're not doing any less of a branch or less of a degree. I mean, okay. And even the branch, many people are really facing so many issues. Are saying anesthesia is not my branch. I have taken anesthesia and I have done a very bad thing to myself, and I'm thinking to drop it. There are a lot of people commenting
yeah.
even after taking MD. So one thing I want to tell you, unless there is a good guide to say you what anesthesia is actually is, you will not love the branch. I'm literally telling you, because I was there in your place and I'm still in your place, and I'm telling you, unless you know the importance of whatever you're doing every day,
Yes.
I should not be saying this, but I tell one thing. Once if you have a good knowledge and liking about anesthesia, and after you read everything, you feel like you have a good knowledge better than surgeons, you have a good knowledge better than your medicine people, because you are everything. Anatomy and physiology is the basics for everything, and you
Correct.
have the knowledge of that basics, and that you are implying onto the patient during surgery or any medical procedure which is happening. Yesterday my
Correct.
short case was on ER. ERCP is it is not done in like operating room. It has a separate setup. Everything is very different. So anesthesia has that separate branch also called NORA, non-operating room anesthesia. So it is very vast and it is very wide. So we have to have a lot of knowledge. So don't feel anything. During diploma, even I felt that I took I mean, am I really doing justice to what I took or not? I really felt bad. And I still feel bad sometimes whenever some person comes and says, oh, what is this diploma? They usually judge it like, okay, okay, diploma, then you're not that good candidate or something. So I feel even if they say that, don't get depressed by that. You start showing your skills, speaking up, and you start read everything and you start showing your skills. Then people will understand that no degree or the title can judge you. It is you what you want to do. Okay.
Correct.
But to go forward, you have to have. I'm not saying people who have done their MD and DM, they're very great, because doing just a 3 years or 2 years residency is only difficult. And they have crossed all that borders and they have reached till there. Even if they have done in private or government, it doesn't matter. They have more experience than you. So definitely they will tell you the pros and cons. Nobody would be telling you that I have done my DM and it is waste. Nothing is waste in our this thing. Okay, in our practice, nothing is waste. Even if they have done anyway, give them that respect. Don't think that the government people who have done they will have a great knowledge, and people who have done in private they'll have more less knowledge, and people who have done diploma they'll have less knowledge, or people who have done MD they have more knowledge. No, no, don't keep, never judge anyone. See, what I feel is that, sir, if I don't know one small thing, if I'm learning from anyone, I feel grateful for that. Even a sister, inside sister, or like any nurse or like intern, whoever is doing, they might have one or the other topic, or that one important thing which you might not be knowing or which you might have missed. So whoever says you, don't feel that why are you telling me, like, do you know better than me? Never think that. So I think mutual respect is what is needed, and they have to have a good communication skills to learn from people and not to get depressed. It's okay to cry. You can have a good friends around you or any seniors like whom you're feeling. It's okay. You can vent it out. You can talk to them. I think there are few people who can be commenting like, "Hey, why are you crying like a kid?" It's okay, no problem. If you want to cry, if you're a 40-year-old also, if you feel like crying, you have to cry. So there is no wrong in crying. You can cry, vent it out, but try to take or get a solution of what you want. So that's what I wanted to say. So it will be a very long topic if we keep on talking. And,
I think we have to stop at some point.
Is there any more questions or something? Then we can come up later on.
Sure.
I hope
so we discussed about what kind of exam is there, what books to study, and whether to continue diploma, and how does a person who's doing diploma is feeling. So this is the agenda with which this video has been done. But what I would like to say is this is a starting point. Actually, this is a starting point, and there's a long way to go. So
it all depends on the individual, that you have to stop it here or you have to grow. And I'm literally telling you, even if you have a dream branch like surgery or medicine, and there are a lot of people who get into the branch and feel like this is very toxic or I'm not able to do, and they are literally leaving the seat also. So don't think that anesthesia is such a branch and you want to leave the branch thinking that surgery is very fascinating, OBGY is very fascinating, or medicine is fascinating. Not a particular branch people are satisfied. Even if you become a cardiologist or a neurologist also, you will not be satisfied in your life unless you know what you want in your life. So nobody is aware of that. But try to enjoy the moment, what you're having or what is in your hands. And still if you can't, then take the step forward. That's all I want to say.
Okay.
Diploma is not thing, anesthesia is the
whatever is there in the place, we have to utilize and learn that to the maximum. That is what we need to do.
Because it is just a 2-year course now, sir. You still have a time. You can even do the DNB. And recently I have met a doctor who has done his MBBS from China, and he has done his MD medicine in China, which is even not valid in India.
We should do a video on China next for the subscribers.
Sure. then I will be very happy to say, because I still miss China a lot. So because he has done his MBBS from China, he has done his MD medicine from China, which is even not valid, but still he has done it. And then he came back to India. He has done DNB in anesthesia, primary DNB, like all the 3 year course in DNB. And then now currently he is doing DM cardiac anesthesia. And he is in second year.
Great. Super. Nice.
So, there are a lot of people whom you can be inspired just being in your surroundings. Okay.
Yeah. So then, Hema, that's it for today. So finally, you have to conclude the session. For a person who is joining diploma now, according to this talk or this video, I think he'll be pretty confident to continue based on the positivity that you have given in this particular video, and you have to utilize whatever is there. That is what is you're trying to tell. Correct?
Yeah. That whatever is there, even if you have a little bit of clue or little bit of thread, you try to pull that thread, then you'll have a lot too. So
Got it,
that's
got it,
what
got it.
I have, and I wish just you also get the same opportunities. And
Yeah.
I feel have that positive mind, and always we are there to help you, all the seniors or like anyone. You can ask us, like even our seniors are like very short of time, but still they try to give us time. So even if we are short of time, we try to give you as much as we can. So in the little bit of knowledge I have shared my experience. So
Yeah.
it might be wrong, or might be not very suitable for most of the people, and I don't even think that everybody has to agree with me, but still,
No.
like, it is what it is.
100% will never agree with you. You have to speak out your voice. 50% will agree, 50% will not agree. That is what.
Experiencing, I just don't want any barrier to be there, so I speak very frankly so that you understand. So that is all what it is. So
that is why
yeah,
I
even
invite
I'm
you to come always.
thank you so much. See, that's what I'm saying. Even I cry. Even I feel like this is a very stupid thing which I have taken as a decision. But still, it is not what it is. It's a very lot more than that. So even I get the thoughts, so it's a bad idea. So it's okay. Whatever you have your thoughts, you can speak it up. No problem. For everything, there will be a solution. So yeah, definitely.
Okay, Hema, then I think we have to wrap up the session. Thank you very much for joining the interview, and this video will help many students who are in the pain points in their life after taking diploma in anesthesia. This is for you guys, dedicated for you. That's why we had a very lengthy discussion. Hope this video will suit you and get you in right track. Thank you very much. Thank you.
Thank you so much.